The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. We're getting ready to head into summer. It's the Friday before Memorial Day. I've got a guest with me that I've been waiting to have on the program for quite some time. Dr. Erin Elliott, say hello to everyone.
Hello, everyone. I'm honored to be here and excited to spread the message that dentists can help their patients sleep better.
Yeah, that's awesome. And so I know that you, and we're going to get into this, I know that you lecture all over the country, a very busy person. Anyone who's following you on social media knows this. Let's start kind of at the beginnings, the basics. How did you get involved in dentistry?
Well, in dentistry itself, I was kind of looking, I knew I was going to be in the medical field. Science just made sense to me. Loved it, loved the human aspect of it. And I feel like we were so complex and just fascinated by the human body. But originally, I wanted to be an emergency room trauma surgeon because I just like action and fast pace, having to make quick decisions. And then when I went away to college, I remembered that I wanted to be a wife and a mom. My dad being a dentist, I don't think I fully understood the scope of what it is that entailed. And so the more I looked into dentistry, the more it fascinated me and realized there's so much I have to offer and how many lives we can touch. And so I went the dental school route, and turns out dentistry just oozes out of my pores. So it was the right decision to make.
Yeah, that's awesome. So let me throw the website. It's Erin Elliott DDS. That's not your practice website, but this is the website where people can go to learn more about you and what you're speaking on and what you're sharing with others. Tell me about the transformation into sleep. I'm sure it's a little bit of what you just talked about, but how did you dive so deep into sleep? And then after you answer that, how did you begin working with other dentists and teaching on this?
Well, in 2003 is when I graduated. And at that time in our life, in my generation, really, we were taught to be good general dentists, fillings and crowns and bridges. And, we better leave the hard stuff like ortho and endo and root canals to the specialist. So we learned how to do dental school dentistry and then write a referral for the rest. But where I went to Creighton, there wasn't a whole lot of specialists. So we actually got a whole lot more experience than I realized than some of the colleagues that went to other dental schools. So I started at my practice that I'm still at in Northern Idaho, Post Falls Family Dental. And then I was at a Idaho State dental meeting, and I saw a sleep physician speak in the morning and then a sleep dentist speak in the afternoon. And this was 2008. And I'm fascinated by sleep. I love to sleep. I put myself down for naps when I was little. My mom said I was easy baby, easy kid, because I would just put myself to bed on my own. And I realized at that time that as much as I love to sleep, there were a lot of people that didn't know what a normal night's sleep was. Not only on top of that, they just weren't even aware that it can be different. Sure. And so once I kind of I call it a dog on a bone, I was determined to bring this to my practice. And I had a bunch of people against me, our own consultant, my partner was like, it doesn't work in a dental practice. But I was determined to make this work because the more I talked to people, the more I realized that it's not an old fat man's disease. And there was a lot of people struggling that have been passed over by healthcare professionals for years. And so when we really kind of brought it into our practice and made it even a bigger and bigger part as the years went on, just how many lives we got to impact. And in the dental world, sleep apnea implementation was such an enigma, like it wasn't possible. There was a mystery beyond with it. And so people found out that this was becoming more and more a part of my practice, and successful at that, that they kind of recruited me into this. Like, hey, whatever you're doing up there, because, they think North Idaho is super rural and we're going to run out of people, that I've treated everyone possible. I was like, no,
Sure.
there's a lot more people than just old fat men that need help.
Right.
So people were saying, hey, can you maybe come teach us how you did that? And so public speaking was my worst nightmare. I still get heart palpitations and almost hyperventilate every time I get in front of a crowd. But I knew I had a message, and I knew I had a fun way to spread that message. And that's my main motivation of hitting the road, because dentists need to be a part of this. We are on the front lines and the medical world is missing it. And so even if a dentist comes to my lecture at a conference and sees the light, and they're kind of like, I don't really want to take this on, at least they're set in a position that they can identify this and get them to someone who can help them. Because
Sure.
we are the perfect partners to help patients discover this.
Yep. So let me ask you this. You're out speaking often. I looked at your calendar on your website. One more time, it's ErinElliottDDS.com. You can grab the link on our site or social. I was looking on there. You're out there speaking. Let me ask you a question. I'm guessing a lot of times it's sleep related. And I ask everyone that's on the show this question. What are some of the challenges that you see that dentists are having? It can be related to sleep. It can be related to their practice or anything, right? What are some challenges that dentists are talking to you about that they're facing?
Well, we're logged down by insurance, PPO, they get to dictate to us. And I just don't think that's right. And I always tease them when I run for Congress, and medical insurance is going to be and even dental insurance. They bully us and really limit what we can provide patients. And somehow they become the good guys and we're the bad guys. So very frustrating. But with sleep, I hear all the excuses. One is that they're so busy. How are they going to implement this? And I'm like, well, my first question is, what are you so busy with? Doing buccal pits? Doing occlusal fillings? Is that really impacting someone's life? So making it a priority to set aside production time to get the team on board to figure out what the workflow is and make it part of your day. So that takes some investment of time and effort. But I know medical insurance is probably number one. We do probably 90% medical billing at this point, because once we took on medical billing, then it took off, and we get referrals, and our regular patients tell other people about it. But you can do sleep without taking on medical billing. We sell Invisalign cases or clear aligner cases all day long.
Sure.
And for some reason, we have it in our head that we can't sell oral appliance therapy. One thing I say is get away from calling the appliance $2,500, but talk to it as the therapy costing $2,500. And we're much more lenient on payment plans when it comes to that. The second is utilizing the power of the sleep study. So we brought in sleep testing into our office. New Jersey is really the only state that really is adamant about not doing home sleep test. But once we get a patient through the sleep test and go through it with them, the magic is there, that all of a sudden they're there. They show up because their wife made them. The hygienist said, I have to do this first before you'll make me a night guard because I'm grinding my teeth. So what we say is, because grinding of your teeth and your airway are so interlocked, we just need to rule out something called sleep apnea, so we make sure we make you the right kind of night guard. And of course, they always show up as having something. So really it's such a part of our practice now that it becomes natural. And I remember when doing my first occlusal amalgam in dental school seemed insurmountable. It was so scary. And now it's just become part of our day. And so
Right.
sleep can become that way, even though it seems insurmountable, even though it seems hard, pretty soon it just becomes routine.
Yeah.
And even if you don't want to treat patients or undergo medical billing, dentists should at least get to a point where they can talk to about it and get them to someone who can help. Yeah.
I think right now, as far as awareness is concerned about sleep, I don't think it's ever been higher. So it is a hot button for so many people. So many people are wearing a Garmin or a Whoop or a Ring just to check out their sleep, just to look at it.
But
I know for myself, I will say that what I learned from Garmin and Whoop is like, just don't drink. Like that's the key to having a great night's sleep for me. And I think for a lot of people, don't drink and you'll be fine. But people are doing it. They're very aware. People are cold plunging so that they sleep better, right? There's a million things they do. I have a bed jet, which I think is fantastic to keep it nice and cool for sleep. So the awareness out there and the amount of products that are being sold right now around sleep are at all-time highs. It's over the top, I would actually say. I'm not saying that it's not important. It's just everywhere. So there's never been a better time to talk to patients about that, but in my opinion. But let me ask you this question, and it's a serious question. I don't think, for me, in my experience working with dentists, I see there's a lot of shiny object syndrome, I call that, where, maybe revenues aren't quite where you want them to be in the practice, and you go, oh, I'm going to become a big Invisalign, and then provider. And then a year later, it's like, oh, I'm going to get into the TMJ. And then a year later, it's, I'm going to get in sleep. How do you decide if like, hey, this is something that you should do? And if you're trying to make it a profit center inside of your practice, first of all, if you're not, you just want to give great patient care, you can refer these cases out. That's pretty simple to do. But if you want to make this a big part of your practice, you want to become an expert, truly an expert in your area at this, and you want it to be profitable. Let's focus on the profitable part about it. What do you need to do to make sure this is profitable?
Well, my dad always said, if you do the right things for the right reasons, the money will follow. And so one of my first steps is start with why, because you're going to have, like, mine was my dad. My why was my dad. He had no idea. He's a dentist himself. He had all the telltale signs, and his snoring we just lived with. But come to find out, it was moderate sleep apnea, and his heart was beating out of his chest.
Sure.
His average pulse rate was 87 beats per minute at night when he was asleep. So it's almost like you have that one personal story that helps you overcome all of the people that are going to tell you no, all of the people that, like, if you do bill insurance, you get a denial and you're going to be like, see, this doesn't work.
Right.
You almost have to have that, like, I'm competitive, I'm an athlete. I'm like, oh no, they're not going to win. And so when I talk to people about this is hard, I tried it, it doesn't work, there's any excuse you give me, any hurdle you put in my way, I will find a way around it. So you almost have to have that bulldog instinct, like, this will work. The people that are becoming more aware is huge. Back in 2009, when I started and I brought up sleep, people thought I was insane. Patients thought I was insane. But now I have people coming to my course saying the only reason I'm here is because too many patients are asking me about it. So the consumer is becoming so much more aware that dentists can help, and an oral appliance is a solution. Now, as far as all of these wearables that people are wearing, the good part is patients are becoming aware that sleep is an important part of total body wellness. The problem is it doesn't really tell you what to do about it. So I'd love to get a hold of all of these wearable companies and say, when the patient wakes up in the morning and they see that they've had a bad night's sleep, it should say, call Dr. Erin Elliott. She can help. Or they dismiss it. So all these people are looking for natural solutions. And what's more natural than oxygen? And, or what's more out, what's more natural than finding something that is going to help you long term that's not a pill? So many
Sure.
people are reaching for melatonin because it's natural. It's a terrible
Right.
sleep aid. It is a terrible
Right.
sleep aid. It just tells your body it's time to go to sleep. It doesn't keep you asleep. So many
Right.
people, especially women, present differently. They present as light sleepers, insomnia, waking up at 1 a.m. and 3 a.m., exhausted, not dozy, sometimes a little higher levels of anxiety. And that's because their body's getting pumped full of fight or flight and cortisol, and their body's fighting to keep the airway open. And so a simple appliance will help keep their airway open, so then their body can finally rest. And
Right.
so we're in the perfect position as dentists to talk to our patients because we know them, identify the dental signs and symptoms, and have a conversation and get them, in the proper direction. So I brought home sleep testing into my practice. We just make it as easy and efficient for people to get to that sleep study so that they can see their story and how it's affecting them. So pretty soon it becomes, I watch my, my ring says I'm doing pretty good. But to me, what's more important is not the objective measurements, but how do you feel? Do you wake up
Right.
refreshed? Do you push the snooze button? And so there's so many opportunities for us to help patients within our four walls. And then once you get the workflow down and you know what to do with that patient, what appliance to use, how to set it, all of those details, then you can go outside your four walls and market and go to physicians and just help that many more people. So that's my goal. Getting on these things, traveling the country, is to get the word out that dentists really are the best people to be identifying this, because the healthcare providers, they don't have time for it.
Right. Yeah. Makes sense. Let's leave with this. I want to say if you're looking, go to website, you list events there is on erinelliottdds.com, upcoming events that you're speaking at. If you're looking for a great speaker on the subject, go to the website, erinelliottdds.com. Dr. Elliott, thanks so much for coming on and sharing today. We appreciate it.
Yeah, I appreciate you. And just one more opportunity to get the word out that dentists should be talking to their patients. And if you yourself don't want to take it on at this point, one way to take it on is start at my course. I feel like it's a good way to get you going, but also just learning to talk to patients and getting them to someone who can help. That's that many more lives you'll impact, and it's their dentist that helps them. Nothing feels better than that.